Hello, and welcome to the Dance Physio Podcast, a podcast designed to explore ideas and foster discussion around dancer health and wellness. We're here to challenge the status quo, bridge the gap between dance science and the studio, and help change the landscape of the dance industry for the better. I'm your host, Erika Mayall, a dancer turned physiotherapist who is deeply passionate about leaving the dance world better than I found it. I'm so glad you're here. Let's get started. Hello, everyone, and welcome back to another episode of the Dance Physio Podcast. Just before we dive into today's podcast episode, I want to let you know of a new free guide that I have available that is for dance teachers. So I have just released a free mini guide on some of the most common cues that dance teachers use in class and why they are problematic from an anatomical or like biomechanical model, and some alternatives of different cues you can use instead to achieve the same desired result. So if you are a dance teacher and you're curious about that, I will link the guide in the show notes here, and you can go and sign up for that, and it will be delivered to you via your email inbox. So if you're a teacher and you're interested, go click on the show notes, sign up for that just before we get into today's podcast episode. So I struggled a little bit with what to sort of name today's podcast episode because I'm not really sure what the most appropriate title for it was. But essentially what I want to talk about is how we name or classify different types of injuries in the medical world, like in the physio world. This kind of came about two different ways. So when I throw out questions and ask for sort of suggestions for podcast topics, one of the ones that's come up a couple of times is people wanting to know about like bursitis and plantar fasciitis. And there's a few of those types of injuries that people are specifically looking to learn more about. And I will do specific podcast episodes like looking at some of those injuries individually in the future. But one of the like little comments that came in via one of the question boxes was somebody saying they wanted to know about the itis injuries, like itis. And then a couple of weeks ago, I was teaching a workshop and someone asked a really good question about, you know, the difference in severity between a sprain or a strain. And this kind of got me thinking about how in the general public, we really don't necessarily understand how injuries are classified or how we, sort of determine the severity of injuries and things like that. And so I just want to take today's episode to talk about the difference between some of these injuries, because I hear this a lot in the clinic too, that I think there's a perception that certain types of injuries are considered more severe than others. So people will come in and say they've rolled their ankle in a dance class. Something that I will commonly hear is they're like, oh, I think I just strained my ankle. I don't think I sprained it. And there's this perception that an ankle sprain is a more severe injury than an ankle strain, when in reality, the way we classify injuries in a medical setting is actually by anatomical structures that are involved. And so in the case of, say, an ankle injury, it is possible that you can sprain and strain your ankle at the same time because it just has to do with what structures are injured. So that's just what I want to dive into today. It will likely be a shorter episode, but really just understanding a little bit about the different classifications. And I'm not going to get into like every single possible injury that it is like, possible to have, but really just the big ones, because I think if we understand a little bit about how we classify injuries, then when you are communicating with a healthcare provider, or if you are a dancer and you're trying to communicate with your teacher, or vice versa, if you're a teacher and trying to communicate with the dancer, it really helps if everybody has a little bit of an understanding of kind of the language being used and what it actually means, because I think people are familiar with all of these words and they get tossed around a lot, but people don't actually understand what that injury classification means. And I am certainly guilty of this in the clinic as well. And I know what a lot of other healthcare practitioners are maybe guilty of this too, where I will sometimes throw out a word like a sprain or a strain or something, and I just assume that people know what I'm talking about, when in reality, like, yes, they've heard that word before, but they don't actually truly know what that means, like what structures are injured. And so we need to remember that this isn't just like general knowledge in the general population, but the more educated and informed people can be, the easier it is to understand what's going on in the body and then also communicate with healthcare practitioners and really truly have an understanding of what that injury entails. So I'm going to start with sprains and strains because I've just been talking about them a whole bunch. So if we are talking about a sprain injury, so SP, not ST, so a sprain injury, that is an injury that occurs to ligaments. And ligaments are the structure in our body, or like the connective tissue band, or whatever you want to refer to it as, but I'll just think of it as a structure that connects bone to bone. And so ligaments are generally not super elastic. They're not like a muscle that's like really, really stretchy. And so they're a little bit more solid than that. They're a little bit less elastic, and they connect from one bone to another bone. And so those are ligaments. And if we injure those ligaments, that is a sprain injury. And the most common sprains that we see in dancers are ankle sprains. And so we have loads of different ligaments in the sort of foot and ankle complex, but there's a couple of ligaments that we will most commonly sprain if we roll our ankle or things like that. And they're usually ones on the outside of the ankle. And there is a podcast episode all about ankle sprain injuries. So if you're interested in learning more specifically about the ankle and like sprain injuries to the ankle, go have a listen to that episode. I will link that in the show notes as well. But a sprain injury is an injury to a ligament. And so these can occur at any ligament in our body. And so we have ligaments that literally connect bone to bone in every joint in our body, has some sort of ligament structure associated with it. And most joint structures in our body actually have lots of ligaments involved in them. So they'll have ligaments on kind of like all sides of the joint. And so when we're assessing an injury, we're not just trying to determine, okay, what's the structure? Like, is it a ligament or is it a muscle? Like, what's injured? But we're actually trying to determine which ligament in a sprain is injured, because that might influence our treatment to some degree. So a sprain injury always involves a ligament, regardless of where in the body it is. So we can have a sprain that happens in the low back, we can have it in the knee, we can have it in the ankle. Those would be considered a sprain injury. And with sprains, we then can grade these in terms of severity, so from least severe to most severe, and I'll talk about this a little bit more after we've talked about strains a little bit. So, big thing to remember, sprains are ligaments. I don't want to say the opposite of that, but another type of injury classification that we see commonly in dancers is a strain injury, so ST. Strain injuries are injuries that happen to muscles. So again, these can happen anywhere in our body, and that is why it is possible if we roll our ankle to have a sprain and a strain, because you could injure the ligament and you could injure the muscles in that same injury mechanism in through there. So a strain injury is always going to be an injury that happens to a muscle. And they can happen in various points of a muscle. So we can have them that happen more like in like the mid part of a muscle belly, which is like quite common with, let's say, like a hamstring injury. Or they can happen closer to like the attachments of where the muscles attach into the bone. And so sometimes you'll hear those be called like insertional injuries, or they can happen where the muscle blends into the tendon, and you can get like kind of strains that happen right at that musculotendinous junction in through there. But a strain is a muscle or is an injury that happens to muscles anywhere in the body. And so similarly to sprains, they can be graded on severity. And so they're also graded from a grade 1 to a grade 3. So in both strains and sprains, a grade 1 injury would be considered like the least severe. So these are generally fairly mild injuries. They, don't impact people's function nearly as much. People aren't going to have to be out of dance for such long periods of time. Grade 1 would be considered like the sort of least severe type of injury. A grade 2 injury for both sprains and strains is going to be kind of like that moderate, sort of middle of the road type injury. And so, it's not a really mild injury, but it's also not super, super severe. So we would consider a grade 2 like a moderate type injury. Now, when we talk about sprains and strains, it
depends a little bit on what structure in the body is injured, like the location and that sort of thing. But generally speaking, muscles are going to have better blood flow and sort of faster healing capacity than a sprain type injury is, than a ligament injury. So a grade 2 strain is not the same as a grade 2 sprain. And I think this is where some of that confusion comes in, where people think like, oh, okay, a strain is a less severe injury than a sprain. That's not necessarily true, because when we look at a grade 2, they're both considered moderate. But when we actually look at the structure involved, a moderate injury to a muscle is likely going to recover or like heal a bit faster than a moderate injury to a ligament. And that just has to do with blood flow and things like that. So we can't compare them directly. It's not like comparing apples to apples. We have to think of like sprains as apples and strains as oranges or whatever. So they're not going to be exactly the same, even though we use this kind of grade 1 to grade 3 grading scale. We definitely are looking at different timelines because the structures involved are different and muscles heal differently than ligaments do. So I think that's where some of the confusion comes in. So people come in, and if they have a mild injury, they'll automatically be like, oh, I think I just strained it. I don't think I sprained it. But really that has nothing to do with like absolute severity. It again has to do with the structure involved. So then grade 3 for both a strain and a sprain would be our most significant injury. So those would be considered like the most severe and have the longest healing timeline. But again, the healing timeline is going to generally be longer for a sprain than it is for a strain, even at a grade 3 level, just because of the healing capacities of those tissues. And again, this is not like an absolute across the board, because there's variations at different parts in the body depending on exactly what structure is injured. So I'm not going to get into that in too much detail. But the important thing that I want you to understand and to realize is that a sprain is a ligament injury and a strain is a muscle injury, so that we're not confusing those, and hopefully we can start to use like appropriate language around those injuries. So if we're talking about a hamstring injury, we'd be talking about a strain because it's a muscle. But if we're talking about an ankle ligament injury and like an ankle sprain, we're probably talking about a sprain type injury. Then we have our itis or itis type injuries. And in sort of like medical nomenclature, the itis just means there is inflammation. And this is actually not completely factually correct anymore, and I will explain that in a second. But when we're classifying injuries, we will still often use like these itis like kind of endings to injuries to indicate kind of an inflammatory type process. And then again, they're just named for the structure involved. So bursitis would be inflammation of a bursa in the body. And so bursa are these little like fluid-filled sacs that we have all over our body. I like to think of them as like little miniature like water balloons almost or whatever. And we have them in areas of like high friction where there could be like rubbing or things like that happen in the body. And generally they're just there and they provide a little bit of cushioning and we don't even really know they're there and they don't really bother us. But if one of them gets inflamed for any reason, and that can be kind of like from repetitive overuse, or it can be from like an acute blow to that area, and you see it sometimes in like other sports, like hockey players, if they like slam their elbow into the boards, like if they're checking somebody, you'll often see that bursa just like blow up really big and get like really, really swollen and really inflamed. So we can have these acute or these chronic bursitises where the bursa has become inflamed. So bursitis would just be inflammation of a bursa. Similarly, a fasciitis, so the one we talk about most is plantar fasciitis. You'll hear people talk about that quite commonly and be like, oh yeah, I've been dealing with plantar fasciitis for years or whatever. And again, like I will likely do a podcast episode specifically on that because it's maybe not always plantar fasciitis that we're dealing with, but it's one that you'll hear commonly. That would just be inflammation of the fascia. And fascia is a connective tissue. It's like a covering that we have in various parts of our body. So our IT band, or the iliotibial band that runs down the side of our thigh, that would be considered like a band of fascia in there. And then the one, again, that we talk about most commonly is that fascia along the sole of our foot. So it starts on the heel and then it attaches kind of in like the ball of the foot area, and it's a really thick band of fascia. And like a plantar fasciitis would be an inflammation of that fascial band in through there. So you can have like a bursitis, you can have a fasciitis, and then the other one you hear about the most commonly is a tendinitis. And so again, this would be an inflammation of the tendon. What I was alluding to earlier was that we actually now know from like tendon research, and tendon research has been really hot for the last like 10, 15, maybe even 20 years. They've been doing loads of research on like tendon type injuries, and they actually know, at least in tendon injuries, that they actually most commonly don't really involve inflammation. So we were calling these like itis injuries, like a tendinitis, for years and years and years, and you'll still commonly hear people diagnose a like Achilles tendinitis or patellar tendinitis or those types of things with different tendons in the body. But histologically, when they actually look at the tissue structure underneath a microscope, we actually know that inflammation is not a huge component of these injuries, and in most cases is actually not present at all. And so you will now hear the terminology of a tendinosis be used more commonly, and that would be like a more accurate kind of description, or a tendinopathy, which basically is just like a pathology or like something is wrong with the tendon. And so you may more commonly hear people using a term like Achilles tendinopathy as opposed to Achilles tendinitis, or sometimes you'll hear like Achilles tendinosis. And so if you have gone to see medical professionals and they've kind of diagnosed you with a tendinopathy, I will get people coming into the clinic and being like, oh yeah, I don't have Achilles tendinitis, I have Achilles tendinopathy, but they don't necessarily understand what the difference is between those. And realistically, the difference is just one person's using the more updated terminology and one person is using a more outdated terminology. So I'm not going to get too bogged down by the details of like tendinopathies and things like that right now. But if you've ever had confusion about why sometimes you hear this one word versus like what we used to call a tendinitis, it's because they're trying to update the language to reflect what we actually know is happening at like a cellular level in the tendon. And so there is dysfunction that's happening in the tendon, but it is not necessarily driven by inflammation. So anti-inflammatory type treatment options are not necessarily going to be helpful in a tendon type injury. So again, this is a huge topic, and maybe one that I'll do an entire podcast episode on, is like really looking into like tendons and what happens when they get injured and sort of like treatment options for them and things like that. But for right now, just when we're talking about injury classifications, that is why you will hear those terms kind of used interchangeably, like depending on who you are seeing kind of practitioner-wise, or even if you're Googling injuries, although I don't recommend Googling injuries. Stay away from Google. It is always a little bit, or it can be a little bit problematic. But if you are Googling things and you sort of are seeing these, what seem like conflicting or like differing injuries, they might actually be talking about the same thing and just using different language around that. So, like I said, I didn't want to get into like specific injuries today. I just think it's really important for people to have like kind of a baseline understanding of what might be involved or what might be going on if they're getting a diagnosis of an injury or talking to like a healthcare professional. So those are sort of the most common injuries. And obviously then we have things like fractures and stuff like that. Like there are loads of other injuries that we can have, but the most common injuries that we see in dancers fall into these categories of strains and sprains, and then maybe some of these itis type injuries or potentially like a tendinopathy type injury. So I wanted to give you a little bit of context because again, the actual diagnosis comes down to the tissue involved in the injury and not necessarily based on severity or anything like that. And then within each of those classifications, then we can assess the injury based on severity. So we can have a grade 1, grade 2, grade 3, for example, or with fractures and things like that. The grading systems are different, but it's the same where there are like grading systems involved in those types of like stress fracture injuries or fractures or things like that. So I hope that has cleared some things up for some people and maybe given you a little bit more kind of insight into where some of this language comes from when you are dealing with injuries and communicating with healthcare professionals, because I think it's important that people understand that so that they can understand a little bit about what is going on in their body. I'm going to wrap things up there today. Like I said, really trying to keep today's episode sort of short and just give you some like really, really tangible kind of information just to help you with communicating about your body and about dance injuries. If you have any questions about that or want further clarification on the different classifications of injuries, please reach out. You can reach me via email. My email is in the show notes. You can reach out via social media as well. You can find me on Instagram at DancePhysioErika. Thank you so much for listening. I really appreciate your support, and I hope you have a great rest of your day.